Welcome. I'm Dr. Corey Burt, upper cervical chiropractor, specializing in correcting chronic spinal problems that are not improving. And over the years, I've spent my time really tracing spinal problems back to the upper neck, with the concept being that I always want to start by assessing and correcting what's closest to the brain. And I'll tell you, the upper cervical spine, upper neck, it is the most overlooked region on the entire body when it comes to causing health problems, right? Because you show me an x-ray of someone's neck, and I guarantee you that I'll be able to tell you how healthy they truly are. Anyways, on to today's presentation, the 7-minute muscular assessment that every massage therapist should be performing on their new patients. So what I'll do, I'll walk you step by step through the same exact neurological and muscular assessment that I am doing in my own clinic. I do it every day, every single day. And the best part is you should be able to do it in 7 minutes or less. And I know this to be true because I've also taught this same content to physical therapists, personal trainers, athletic trainers, and coaches as well. But it all started with massage therapists because one asked me to teach it to them, mainly for the use that they could be doing it on their patients. And I'll never forget what she told me. The gist of it was that a lot of her colleagues don't do any sort of assessment or evaluation on new patients. And when I performed the assessment on her for the first time, it just made so much sense to her that she asked me to teach it to her colleagues. And then from then on, the class just continued to grow until I moved to Oregon. And then COVID hit, so I stopped teaching this in person. Now I'm doing it online. And although it's nice to do it virtually, I prefer to teach this content live in person with a group of people so that you can actually practice it. So we'll get there eventually. Hopefully this year we can start back doing that. Okay, let's jump right in. So the goal of the assessment is to, one, help establish a baseline for the patient, and then two, locate the underlying cause of the concern. For example, if someone has back pain, the goal of the assessment is to find out where that back pain is coming from. Is it the low back itself? Is it compensating from somewhere else in the body? The foot, the hip, the neck? That's ultimately what we want to find out, where the pain or the problem is coming from. Now, to do the assessment, you only need two things: some sort of table and some sort of cervical support to keep the head and neck in a neutral position. Really simple. The assessment overview, I will break down each and every one of these steps, starting with patient positioning, then move on to leg length comparison, low back palpation, shoulder strength. Then all of these tests will be performed again with the neck rotated to the right and to the left. And then we'll finish off with palpating the upper neck just beneath the skull, suboccipital muscles. I'll kind of dive deeper into that. First things first, you want the patient lying supine on their back. And the reason you want them lying on their back is because the spine is in a much more neutral position compared to lying on the stomach. If you have them lying on the stomach, you have the rib cage affecting the position of the spine. And the rib cage really just distorts things and can throw off your measurements. So just keep that in mind when you do it. You'll also want a cervical support to be underneath the neck, so it's in a neutral position. I personally just use a pillow, really small one, and it works out just fine. And then lastly, just make sure that the patient doesn't have anything in their pockets, and make sure they don't have any heel lifts in, because that would also distort the measurements. Okay, leg length inequality. So what you'll do, you'll want to compare the length of the patient's legs. And why would you want to do this? Well, because in 90% of my patients that I assess, I see one leg that is shorter than the other. Now, what does this mean? Does it mean that one leg actually grew shorter than the other? Not likely. It means that likely they have a tight back muscle, which is contracted, which is pulling up on the hip, which is pulling up on the femur bone, and then, of course, the rest of the leg, making it appear to be short. Because when the extensor posture muscles are contracted, right? We're talking about the QL, the multifidi, some of the rotators. This is going to distort the position of the lumbar spine and the pelvis, which will in turn cause and change the length of the legs. Now, sure, there is a 0.003% chance that the leg actually grew shorter than the other, and the small amount of people that have busted their leg, broke it, tibia, fibula, ankle, something of that sort. So sure, that'll also distort or potentially cause a short leg, but really it doesn't happen too often. Now, when I measure for leg length, I have three fingers wrapped around the back of their shoe, right? The index, the middle, and the ring. And then the pinky, I have it rest on the sole of the shoe, just like the picture that you can see. The pinky's on the bottom so that I can press up on the heel, removing any heel slack that may exist between the heel and the shoe itself. If the patient doesn't have shoes, it'll make this test much more difficult because you're using the ball of the heel as a reference, which isn't as accurate as having a flat surface such as a shoe. Same thing with flip-flops. They can be squishy and just not as consistent. Again, the whole goal is to be as reproducible as possible. Now, after looking at the legs, you want to move up to the low back, and you want to test to see is one side tighter than the other, especially if you see a short leg. You should expect the posture muscles to be tight on that same side. So, for example, if the left leg was pulling short, most of the time you should find that the posture muscles on the left side are also tight, right? Tight muscle pulling up on the hip, pulling the femur short, and pulling the rest of the leg short. Now, occasionally, you might find the opposite side tighter, right? If you see a left leg short and pulling up on the back, you also will see that the right side is going to be tighter. So opposite, left leg, right side back is tight. So you know you have a more complex case. And instead of pulling up on the hip, it's going to be more of a rotational problem compared to kind of a simple linear tilt. So keep that in mind. Now, my hands are going to be around L3 area, and I'm lifting up on both sides, comparing right to left. And again, these are the spinal extensor muscles, QL, multifidi, rotators. And keep in mind, the posture muscles are designed to keep you upright when you are standing. These muscles should not be activated or tight, contracted when you are lying down. If they are, this is a problem, but some sort of neurological muscle imbalance has to be going on. So note which side, which leg is short, and then which side of the back is tighter, and then move up to the shoulders. Again, you'll be comparing right to left, shoulder strength right to left. You'll tell the patient to make a fist with their arm, reach it straight out, and then you'll start on one side, applying pressure just below the wrist, asking them to resist. And then you'll switch arms and just note which side is weaker. And if there is a weak side, which most of the time there is, it would be fair to, at this point, think that they may have some sort of shoulder problem going on. But before you jump to conclusions, ask them to turn their head to the right or the left. And then you'll want to test that weak arm again. Key term, weak arm again. And you'll note any changes in strength. Notice if it makes it shorter, if it makes it stronger or weaker. Then tell them to turn their head to the other side, and then same thing. Note if it makes it stronger or weaker. So with cervical rotation, if you do have them rotate and it does affect the strength of the shoulder in any capacity, you know that there's an underlying neck problem that is affecting the shoulder. It could also be a health problem too. But usually one side will increase the strength of the shoulder while the other side will usually decrease or weaken the shoulder strength even more. Now, by the way, we choose to test the shoulder muscles, anterior deltoid, due to the C6 nerve root controlling the shoulder muscles. And of course, this is going to be running right through the cervical spine. Now, what you want to do next is whichever side the head was turned to that strengthened the shoulder, you want to have them keep their head turned to that side before you go down and retest the low back erector spinae. So you're going to go back down and see if keeping their head turned to that side also relaxed their back muscles. And I'm telling you, this happens way more often than you'd think. And while continuing to feel the posture muscles, have them turn their head back to the other side. And generally, you'll also notice that it'll make the back muscles tighter. Again, and this is the case, then you know that you have an underlying neck problem that is contributing to the cause of the back problem. So if you notice any of that, well, regardless, you're going to go back down to the feet and compare the leg length as they turn their head left and right. And again, you should notice that the same side that strengthened their shoulders and relaxed the low back muscles should be the same side that will balance out their leg muscles. And it's incredible to see the patient response. You tell them, hey, you've got a short leg, and then you tell them to turn their head and it balances out their legs. And it's really just incredible to hear their responses. A lot of them are in awe, and it's fun every single time. Okay, moving on, upper cervical palpation. This is going to be the last part of the assessment. And really, we want to just dive deeper into the neck, specifically the upper neck. And what you'll do is have them sit at the foot of the table. You'll have them be nice and upright. And you're going to want to be feeling for what's called the C2 DNRG, or the C2 dorsal nerve root ganglion. It's going to be located between the mastoid process and the C2 spinous. And now if it's inflamed, you should be able to feel this, and you'll also know because your patient will not be very happy. It's generally very painful, and when someone's pushing into that swollen nerve. And generally, you will feel it on one side. And I found that head neck trauma is going to be the primary cause of the swelling of the C2 nerve roots. And if the patient has a swollen C2 nerve root and you turn your head, this is going to result in either more tension on the nerve root or less tension on the nerve root, obviously affecting the entire spine just as you saw. But remember that 50% of all cervical rotational range of motion, so looking to the left, looking to the right, is going to come from the upper neck, specifically the top two bones in the neck being C1, C2, or atlas and axis. So if you see that there is a problem with cervical rotation, then you always want to start by looking at the atlas and the axis. Right? The muscles that are attached to them, the suboccipital muscles, which, as you know, are the most sensitive muscles in the entire body. And of course, they're attached to the atlas and axis. So that wraps up the assessment. Pretty simple. In summary, if you got one thing from today's presentation, it's this. If your patient is lying on their back and they turn their head from left to right, and you notice a change throughout the rest of the body, rest of the spine, then you know it would be a good idea to palpate the neck on both sides, right? Right underneath the base of the skull, assess the suboccipitals, assess the C2 DNRG. But regardless, I just encourage all of you to do some sort of assessment with your new patients if you're not doing something already. And I know that a lot of you guys are, but some of you aren't. And I'm talking those ones that aren't doing anything. And even if you are, and if you want to add this to your protocol, your system, that'd be awesome. And I know that your patients will love it. And that's what it's about, right? The patients. And really, I'm telling you, like there's so many times where if you do some sort of evaluation, they really know that you care and they just really, really love it, and they'll be patients for life. And at the end of the day, you'll be able to see for yourselves, right? And then you'll get to correcting the integrity of the suboccipital muscles. Right, I'm telling you, like focus up there on these cases. If you notice that, I'm telling you, your results will skyrocket and you'll do a lot better. Your patients will get better faster if you do start with correcting what's closest to the brain, philosophically there. And now, of course, you'll still continue to work on other parts of the body, but the upper neck is the best place to start in these situations. So that's the takeaway. I hope you get that. And if you are working on the neck and you still aren't getting as good of results as you expect, I'd be more than happy to take a look at them, co-manage the case with you by evaluating the structural aspect of the upper neck. From my perspective, I would be taking 4 x-rays of the neck, head and neck, seeing just really the exact positioning of the bones, and then of course use our spinal software to analyze and measure everything from the occiput to atlas axis all the way down to C7. And I'm telling you, if you want to correct the position of the upper cervical spine structurally, you need x-rays. With the rest of the spine, it's not as complex, so you don't need them as much, but up here, it's essential. Absolutely essential. And again, with every therapist that I work with, I always send the patient right back to you and recommend the soft tissue work in addition to what we do structurally. Again, working on the suboccipitals is going to help out massively with patient results. And that's what I found. Correct the structure, soft tissue work to the suboccipitals, and it is just a recipe for success. Okay, last but not least, if you want to learn more of the science of how the upper neck really affects the rest of the spine, the neurology, biomechanics, all of it, then take the rest of my course. It's only 1 hour. It's all online, super easy. It's called Unraveling. Let me get it pulled up. Unraveling Upper Cervical Anatomy, Biomechanics, and Neurology. Now, normally I charge $55 for it, but because you watch this presentation, I will waive the fee completely. And another bonus is that you'll also get a certificate when you complete the course. Of course, you got to pass the quiz, which will go towards your CE requirements for the year. And I went ahead and went through the whole process of getting this course approved, CE approved, through the Oregon Board of Massage Therapy. So everything checks out there, you're clear. And if this is any interest to you, get your phone out, open up your camera, scan this QR code, and just before the checkout section, make sure you put in the code ATLAS. And that should set you up just perfectly. Also, I'll include the link in the description if you are watching the replay of this. So that just about does it. If you have any questions, please send me an email, support@eliteuc.com. And thanks for tuning in, everybody. Take care.